and Parkinson's disease. So, what is the autonomic nervous system? And it's actually a very important topic in medical school, and neuroanatomy and pharmacology. So the autonomic nervous system is that part of your nervous system, which, by the way, the nervous system isn't just the brain. The brain is called the central nervous system. The peripheral nervous system is all parts of the nervous system outside the brain. So that's just a structural to the nervous system. Brain, central nervous system, outside the brain, peripheral nervous system. So what is the autonomic nervous system? Well, it's that component of the brain and peripheral nervous system that controls the function of all of your viscera or organs. So that's autonomic, and the reason it's called autonomic, it's automatic. You have no volitional control unless you're a yogi who's meditated for 50 years and can just by meditating increase his heart rate or decrease the heart rate. It's something that cannot really be done volitionally. Okay, you can hold your breath only for a certain amount of time, but then it's just going to kick in automatically. There's no way you can stop it. So the most important part of the autonomic nervous system is really the central part of the autonomic nervous system. So everyone, I want to just explain some where these structures are and what is the nervous system anyway. Well, I said the autonomic part of the nervous system is that part of the nervous system that automatically controls your organs. And what everyone is most familiar with is how the autonomic nervous system controls your gut and your bladder. It's what automatically causes movement of your intestines, that promotes digestion and that promotes bowel movements, right? It's a whole nervous system, almost a brain within your intestines. But it's more like a network. If you look at the nervous system under a microscope in a gut section, say an intestine, you'll see it's like a network. It looks like a spider web. And by activating the nerve impulses to the gut, it causes the muscles of the gut to contract and relax, and so you have bowel movements. Similarly, the autonomic nervous system that controls the bladder. It's like a network of nerves that will contract the bladder when it's stretched to a certain distance. So the nervous system has not only motor output, right, causes the nerves stimulate the muscles to contract, but they also have sensory feedback. They're sensory nerves, just like touch and smell are all sensory nerves. Well, the autonomic nervous system has sensation too. It doesn't reach consciousness though. And typically the bladder will just empty spontaneously, but when it gets stretched a certain point, you do become aware of it. And there's two parts where the voluntary or skeletal muscle nervous system, because all volitional voluntary muscles are called skeletal muscle. They're different than the smooth muscle of organs. So the skeletal muscles, volitional, the ones you have control over, control the sphincter of the gut and of the urinary outlet. So you can volitionally inhibit the bladder. You just tighten up your perineum and you can hold your urine, right, for a while. But at a certain point, it's just going to break through because you can only hold it for so long, like you can only volitionally hold your breath for so long. And the same with bowel movements. You can control the sphincter, which is volitional. It's a skeletal muscle. And you can hold, you have the urge to go to number 2, well, you can hold it for a while. You have volitional control. But after a while, the automatic movement takes place. Finally, eating and swallowing. Swallowing has an automatic component, triggered once it gets into the esophagus and up towards the back of your throat. It's an automatic process that you have no control over, but you have some control over initiating the swallowing and the chewing. But once it gets past a certain entry into the gastrointestinal system, it's automatic. And I'm just describing places where the autonomic nervous system interplay with the voluntary nervous system. Now there's one place that it's really hard to volitionally control. That is your heart rate and your blood pressure. If you could volitionally, willfully lower your blood pressure or increase it, there are ways or tricks that allow you to do that. Like, for example, if stress increases your blood pressure, and it's known to, well, you just sit down quietly, you relax and think positive thoughts, and you'll see your pressure starts dropping, your heart rate starts slowing down. And that's how the yogis eventually learn to either increase or decrease their heart rate just by getting into a certain mind state. So at a certain point, your higher levels of the nervous system can take over some of the automatic nervous system function indirectly. There's just no direct control of volition with heart. It takes some indirect association meditation. So I haven't even talked about how Parkinson's disease affects this. I'm just giving you an idea of the complexity of the autonomic nervous system. So the thing that is most commonly involved in the autonomic nervous system is the control of your blood pressure. This is something that's important to think about because we have that problem in Parkinson's disease. So your blood pressure is so critical for general health. Blood pressure has to be a certain range in order to perfuse all the organs. If the blood pressure drops too low, you get decreased perfusion of all your organs. They don't get enough oxygen or sugar, and so they suffer. And so when you get into shock, usually what happens is no blood flow. The blood pressure drops. That's a state of shock. All the blood vessels dilate, and there's no circulation, and it's very dangerous. A state of shock after, say, a terrible trauma or even emotional shock, you can faint because the blood flow drops. The blood flow to the brain. If you have septicemia, you have an infection that has affected all circulating in the blood, you can get what's called septic shock, and that can lead to death because the blood pressure drops. Significantly, when you don't have blood pressure, you don't have blood flow. If you don't have blood flow, the organs that receive blood die. And the brain gets most of the blood flow. The brain of the whole body, the brain gets 20% of the cardiac output. With each stroke of blood of the heart, your brain gets 20%, even though its percent of the whole body weight is really not 20%, it's much smaller. So a person has a 2.2 pound brain who may weigh 170 pounds, and yet he gets 20% of the blood flow. That's how important the brain is, that it gets right away, it gets the best of the blood, so to speak, right out of the oxygenated blood that enters the heart from the right to the left. And okay, so in Parkinson's disease, what happens? Well, we know it's a dopamine system disorder in part. We know that as we lose dopamine, automatic movements are interfered with, but I'm talking about volitional movements, the ones that you've done, that you've learned all your life, like getting up, rising, reaching out, standing on one foot. All of those automatic motor activities are mediated through these deep gray structures of the brain and running programs that are stored in the frontal cortex. So all of the programs for automatic motor activity, walking as an example, is stored in frontal motor, premotor cortex, we call it. And when you go to initiate something, automatically the basal ganglia, those deep gray structures of the brain, execute the movement without you completely thinking about it, automatically. All right? What happens if there's a derangement of dopamine in the basal ganglia? Well, it's hard to initiate a movement, and the movement is slow, and there's rigidity. So that's the basis of dopamine deficiency in the basal ganglia. It's not a problem of the autonomic nervous system, it's a problem of automatic movement. So how does the autonomic nervous system get involved in Parkinson's disease? Well, I should say, how? Yeah, how? First of all, dopamine, is a chemical made from levodopa, which is a naturally occurring amino acid, and there's not enough of it being made. But norepinephrine, which is a downstream amino acid, it's made from, again, levodopa. It's made from tyrosine. Anyway, the biosynthetic pathway of dopamine and noradrenaline, also known as norepinephrine, also adrenaline, are all very similar chemical structures. And the neurons, the brain cells that make dopamine, that make noradrenaline, are very similar. They're called monoaminergic neurons because these are monoamines. And in Parkinson's disease, not only do we lose dopamine, we lose noradrenaline. And noradrenaline happens to be the most important neurotransmitter for the autonomic nervous system. The neurotransmitter that mediates a lot of the visceral function. But the visceral function has like an accelerator and a brake, and the norepinephrine is like the accelerator of it. The brake would be the acetylcholine vagus nerve. The best way to think about the autonomic nervous system is to think about the sympathetic and the parasympathetic system. And then the best way to think about how I tell the medical students, and I'll try to explain it to you, is that when one is frightened, suddenly shocked, ready to fight or flight, think of the caveman confronting a saber-toothed tiger, or you confronting a would-be mugger. I mean, what happens is the autonomic nervous system gets you ready to fight or flight. And it's partly mediated by adrenaline release from your suprarenal gland, but also by noradrenaline activation of the sympathetic nervous system. So you know that the autonomic nervous system, the accelerator part of it, we call it the sympathetic nervous system, is turned on in fear, fight, or flight. What's that situation? Start from the top. Your pupils get big. Your hair stands on end. Your heart rate accelerates. Your blood pressure increases. Gut is shunted from the stomach to the muscles. That gets you ready to fight that saber tooth or run like mad.
Run like hell.
And if you don't, and you're paralyzed, you're going to shake all over, right? Because you're all revved up. That's the sympathetic drive. And there are drugs that mimic adrenaline and noradrenaline. Those are the psychomotor stimulants like amphetamines, cocaine. They mimic, and people get some pleasure out of that because not only does it turn on your ability, it makes you feel strong and you know, without fatigue and no appetite, ready to conquer the world. That's what psychomotor stimulants do. It stimulates that part of your autonomic nervous system that gets you aroused. And not only does it stimulate your motor system and get your organs ready to run around, it cuts your appetite, of course, so why weight loss pills are often psychomotor stimulants, because blood is shunted away from your gut. There's no hunger. You can become aggressive. You can become paranoid. Your mind races. And what's fascinating about it is you're less likely to make errors in boring tasks. So, and it gets rid of sleepiness. It makes you alert and oriented. In other words, if you take that autonomic nervous system and tweak it toward the sympathetic drive, you're going to get a speed freak. Right. But
you can't get those diet pills anymore.
You actually can, but I don't recommend it. You know who had Parkinson's disease, who was treated with amphetamine? Adolf Hitler. Because L-dopa hadn't been discovered. He had Parkinson's disease. I don't know how many of you know. Abe Lieberman has researched it, and there's video of him. You see his handwriting gets smaller and smaller. It was his left hand. He could do this without shaking, but this hand would be shaking, and he'd hook it on his belt. And, you know. So Hitler had that, and his doctors, in the old days, they used to use belladonna alkaloids. Weren't very good, but they began to realize that, you know, that slowness and rigidity could be improved transiently with amphetamine. And the amphetamines were being developed in the 1930s as bronchodilators. You know, because of what the sympathetic nervous system does. Remember, it gets your heart rate up, gets your blood pressure up, and opens the airways, ready to take in a lot of oxygen. Think of it ready to fight or flight. So they gave him amphetamine, and supposedly it was effective, but it probably made him a little crazy because chronic amphetamine use makes you psychotic, and it starts mimicking, a psychosis like schizophrenia or paranoia and delusions. And aggressiveness. What's the opposite of that? The opposite of that is what happens. That's called the parasympathetic. It's the brake. My teacher said, imagine a retired gentleman, age 75, just ate a big meal, is outside in the hammock, what's going to happen? He's going to get real sluggish. His secretions or blood is shunted from the muscles into the gut to promote digestion. Pupils get small, the lids get closed, you get really lazy, you lay down and you take a nap. So think of it as an old man after a big meal in the evening. That's the parasympathetic nervous system. Your digestive system is outward, all the juices are flowing, and you're very, very relaxed. You don't want to confront the saber-toothed tiger at that point. Yeah, you just want to go into your cave, shut down the lights and rest, digest your food peacefully. So that's a parasympathetic nervous system, and that's mediated by nerves from the autonomic nervous system that go to your it's called the vagus. If you know Latin, vagus means lazy. Yeah, it's the lazy nerve. You stimulate the lazy nerve and everything slows down. Your heart rate gets vagus nerve, it slows the heart rate down. The heart gets noradrenergic nerve, it speeds up the heart. Every organ has got the brake and the accelerator. So the parasympathetic is the brake, sympathetic is the accelerator, and those accelerators are very similar to dopamine. Dopamine is a step just before norepinephrine, and they're all very similar to adrenaline. Adrenaline is like a special form, a special way to really activate the autonomic nervous system, the stimulant part, really quickly, because it's the adrenaline, when you're suddenly frightened, is released into the blood, it circulates quickly and activates all of those sympathetic noradrenergic receptors and get you ready to fight or flight. So you not only have nerves, you have a hormonal response, which is adrenaline. A hormone is just a chemical substance released by one organ into the bloodstream that will affect other organs. That's what a hormone does. Whereas a nerve will affect the cell directly because it's connected with a synapse. So the organs respond to hormones released in a sudden moment of fright, adrenaline, stimulates. They also respond to the nerves from the autonomic nervous system. So what happens in Parkinson's disease is you begin to lose the sympathetic nerves. You begin to lose the noradrenergic neurons. And that's been shown in animal models and in patients. When that happens, you begin to have problems, the blood pressure gradually decreases. The ability to maintain the blood pressure when you go from sitting to standing drops because the autonomic nervous system has sensors, as I said, it's not just motor. And there's sensors called baroreceptors that are sensitive to blood pressure in your internal carotid artery. And that's part of this sympathetic nervous system, but the baroreceptors will feed back into the central autonomic nervous system and determine what the pressure is. If it's too low, the signal is sent to all of the sympathetic nerves to constrict the arteries a bit and increase the heart rate a bit so that your blood flow to the brain remains constant. So when you are sitting real low and then you get up quickly, your heart has to pump a lot harder to maintain the same blood flow because gravity is pulling down. Gravity is a much more important force than we take. We take it for granted. But it's gravity that gives us our appearance of aging, by the way.
Yes.
You notice everything is being pulled down?
It certainly does, Ollie.
Yeah. So gravity has a big effect on your cardiovascular system. That's why so many people have what's called orthostatic hypotension who have Parkinson's disease. They stand up and they get a little woozy after a while. And that's because the sympathetic drive of the autonomic nervous system is not like it used to be. And I'll tell you how we treat that. So the other part, so that change of low blood pressure when you stand up is one of the signs of autonomic nervous system derangement in Parkinson's disease. It's universal. And to make it worse is that dopamine replacement and levodopa exacerbate that and lower the blood pressure even more. So whenever we are starting to increase dopamine replacement, I always say you might get lightheaded if you stand up, and if you're taking high blood pressure pills, you may need to talk to your cardiologist about getting off of those, because that's the most common reason people feel faint when they get up. They're over-medicated with their anti-hypertensive drugs or diuretics, or they're taking, things for their prostate, medications that increase urinary flow. That will lower blood pressure too. So you are aware of this lightheadedness as a symptom of autonomic nervous system dysfunction. Second most common thing constipation. The gut of the nerve of the nerves of the gut also start degenerating, and partly centrally and also locally. That network looks like a spider web, is full of noradrenergic neurons, and many of them start accumulating Lewy bodies. So the same process that we have in the brain is going on in the nervous system of the gut, the autonomic nervous system. That's another reason that we begin to have sluggish bowel movements. And if you know, a lot of the stimulation of the gut is automatic, but some of it's volitional. If you were to do 30 sit-ups every morning, that would actually help move the bowels. It's almost like someone can't breathe, they had a cardiac arrest, you compress their chest.
Yes.
You're gonna breathe, you're gonna get the blood flow perfusing their brain. So if you have sluggish bowels, I recommend you do some sit-ups. Use your skeletal muscle to rhythmically stimulate your bowels. And of course, caffeine and certain kinds of fiber. But the autonomic nervous system becomes not as effective, and eventually can be very severe, so that people just hardly have bowel movements. It's very difficult. The third is in control of the bladder. And many of you have that problem, urinary frequency, incomplete emptying of the bladder, and then that sets you up for urinary tract infections. Again, it's a problem with the autonomic nervous system. In men, it's compounded by prostatic hypertrophy, where the bladder doesn't empty completely because there's so much enlargement of the prostate, and the urethra goes through the prostate, so there's tight narrowing of that channel. So people go to the bathroom, they have the urge, they can't empty it completely, so they have to go frequently, small volumes. So this bladder issue is much worse in men than in women, though it definitely affects women. Women can have other bladder issues from having had children, from going through childbirth, and they can have problems with their bladder structure and position. The thing that is really that people aren't aware of about the autonomic nervous system, it's what regulates our perspiration, and like whether you have your hair standing on end, the temperature of the skin, all of that's controlled by these very fine nerves of the autonomic nervous system. And so people do have sensory symptoms related to changes of the autonomic nervous system. They'll feel very cold or very hot. They'll perspire excessively. They'll have like tingling, unusual sensations, even though they don't have a standard peripheral neuropathy. So feelings of hot and cold were actually described, and excessive feel hot or excessive cold were described by James Parkinson. In his monograph, he noted that one of the patients he observed was sweating so profusely that he had to take his greatcoat off even when he went outside because he was so hot he couldn't bear wearing a coat. So, bouts of nocturnal sweating is very common. You wake up and your sheets are all wet because you've gotten very hot. You almost as if you had a fever. And the other way is true, where people are feeling very cold. When people are feeling very cold, I worry about thyroid problem, so I'll check that. But it's not unusual as an autonomic nervous system deficiency. Now, everyone with Parkinson's disease, the classical form, will develop some aspects of autonomic nervous system dysfunction, but it's usually not that severe. But when the autonomic nervous system dysfunction is really a prominent feature of the whole illness, that's called Shy-Drager syndrome, or it's Parkinson plus, or multiple system atrophy type A, autonomic. And those are the patients that it's really difficult to treat with anti-Parkinson drugs because their pressure is real low, and then you add levodopa and it drops even more. So those are the patients where they're lying down, they sit up and they feel woozy. They can only feel better if they're lying down. So the secret for that condition is to maintain blood flow and blood pressure. And there's several ways to do it. Number one is to increase the amount of salt that people eat. And that'll increase the blood volume and indirectly increase the blood pressure. Now, that's even in people who've been told they have high blood pressure, now they have really low blood pressure, so you're going to do the opposite. It's almost like, okay, I have my tires real low on air. Well, the way we increase the blood volume is put in salt and water. You know, people who are dehydrated go to the hospital with severe dehydration. They put an IV with just 0.9% sodium chloride. That'll increase the blood volume, increase the blood flow. So that's the first step that I'll tell patients. Every time they get up, they feel lightheaded, I make sure they're not over-medicating on their antihypertensives. Secondly, I'll add salt to their regimen, provided their cardiologist will let them. Because if they have congestive heart failure and Parkinson's, then you're in trouble. You can't do that. So, but that usually works. Secondly, I recommend the use of TED hose, which are thigh-high compression stockings. And that will prevent pooling of blood when you stand up. So there's less of a drop in blood pressure. The third step is to add Florinef at night. Florinef is a mineralocorticoid that instructs the kidneys to hold on to salt. And when the kidneys hold on to salt, it holds on to water. So you end up increasing your blood volume and increasing your blood pressure. And finally, there's two other drugs that are often used. If all of these things are still not resolving, and in Shy-Drager, the pressure drops can be really, really significant, you might need to use something called midodrine, which is a pressor. It's an agent that constricts arterial blood muscles, arterial vessels, so that they're a little tighter and increase the blood pressure that way. It's almost, those are drugs that act like noradrenaline to some degree or another.
Could you repeat the name of that?
Midodrine, M-I-D-O-D-R-I-N-E. And now there's another one that's being reintroduced. It's called, it's a norepinephrine precursor called Dopadrox. It'll come to me. It's new, but it had another name when it was introduced as an agent to improve gait and balance, and then it was shown not to do that. But that's relatively new. It's being reintroduced, and generally it's not for general use in our Parkinson's disease patients, but people with Shy-Drager syndrome, which is Parkinson plus, with tremendous problems in maintaining blood flow, gut movement, etc. I'll take questions now about it.
How about Dr. Swallowing? What can we do to help that?
No, she's the expert on
Well,
swallowing.
no, we've been with Mary. We have.
Well, that's what I do about swallowing. I send them to Mary or to her colleagues who do swallowing studies.
Right, and I mean the amount of saliva. He swallows and practices a lot. But the saliva, if he does not go automatically off to sleep, becomes a real issue.
Yeah, so
What can we do?
the excessive salivation
Yeah.
is a problem because people are not swallowing automatically. There's the frequency of swallowing, the frequency of blinking decreases automatically. So if you can improve the frequency of swallowing, and that sometimes improves with levodopa, but at a certain point it won't. The next thing is anticholinergic drugs, which I don't like to use. They inhibit. Those are artane, cogen. They inhibit salivation, but then people complain their mouth is like cotton, and it can worsen memory problems and cause urinary retention and worsen constipation. So I don't use that for excessive salivation, unless it's give only a small dose at night. Then it's okay, but during the day I don't think it's a good idea.
He doesn't have the problem any other time but at night.
So a little bit of anticholinergic drug like artane at bedtime. Then finally, the thing that works best, and more people are doing it, are Botox injection of the salivary gland. That inhibits the autonomic innervation of the salivary gland. And so you have a little less, you have actually significantly less. You don't completely suppress salivation because then you wouldn't be able to eat. You know, so it would inhibit it, and that you need to be referred to. Usually I send to ENT docs for that, and they would inject a little Botox into the salivary gland. It's right under here.
How about gum?
Well,
Gum will increase your frequency of swallowing, so that's good in the day, but you can't do that at night.
thank you very much.
Yeah,
You cannot
and
do
you,
it.
because you'll get pneumonia, you'll clog up, you'll
We've
get
already had
and, yeah, yes.
My question is cerebral vascular problems. Are they similar to the Parkinson's problems?
Well, cerebrovascular refers to blood flow to the brain, and cerebrovascular events are strokes. There's hemorrhagic occlusions and embolic strokes. It's completely different kinds of neurological deficits when you occlude a blood-brain vessel, you bleed. It depends on which vessel and what territory. It's independent of Parkinson's disease.
Okay.
You get paralysis, you get aphasias, you get a whole bunch of stuff. However, microvascular occlusions in the white matter underneath the frontal cortex interferes with the basal ganglia loops, and you can get what's called lower body Parkinsonism, secondary to microvascular disease. Microvascular means the capillaries are occluded. It isn't like the big vessels that are occluded that result in obvious stroke. So people that have gradual occlusion of the small twigs of blood, a blood supply, they're little teeny capillaries that supply at the end branches. Think of it as a tree. You got a big trunk, like the carotids. You branch the middle cerebral, anterior cerebral, about as big as this, and then they branch and they branch. And those final tiny branches that go to the white matter under the cortex, they're the ones that become occluded as we get older, naturally, if you have chronic hypertension or diabetes. And so someone with vascular Parkinsonism, we call it lower body Parkinsonism, because this is what it presents like, usually in your 70s and 80s. People with Parkinson's disease present in their 50s and 60s. People with Parkinson's begin with one side, where they walk slightly stooped, they don't swing an arm. People with lower body Parkinsonism, they'll present like this, and the arms are loose. And they have a gait problem, and they're saying, oh, the doctors told me I had Parkinson's disease. Well, those people don't respond to levodopa, and they have occlusion of small blood vessels. You can see it on MRI. The big difference is the gait looks Parkinsonian, but much more advanced. It's not asymmetrical. And their arms are loose. They have no motor, no rigidity. So when you see them walking, they'll be like this. The arms are going like this. And it's hard to get initiated. Now, in Parkinson's disease, when it begins, it might look like this. And then eventually like this. And then like this. But you see there's a stoop, there's a rigidity in the upper extremities, one side more than the other. The age of onset, the MRI, the clinical presentation distinguishes lower body Parkinsonism from idiopathic Parkinson's disease. Had nothing to do with autonomic nervous system. But go, you just had, what was your question? Really? You just said, what about blood flow and Parkinson's disease?
Blood flow, cerebral vascular.
Yeah.
Is it connected to Parkinson's? Same problem?
I just told you.
Yeah.
The way it's connected is through a syndrome called lower body Parkinsonism, but they don't have Lewy bodies. They don't have a lot of the characteristics pathologically and clinically of idiopathic Parkinson's disease, and they don't have what Parkinson plus, so to speak. They have what's called vascular Parkinsonism.
This might be the wrong question for you. Recently I had an MRI. My brain showed more little white spots.
That's exactly how you see it. So that's microvascular occlusions. It looks like little white spots. We all get them once you get over 50.
Okay,
But when there are a lot of them, it's going to present with dementia, mild cognitive impairment, and a gait disorder that mimics Parkinsonism.
Does increased blood pressure have a problem?
They tend not to have increased blood pressure, but normally with aging, your blood pressure gradually creeps up. So yeah, that's what. It's just a normal aging phenomenon that the tiny final twigs of the arterial supply to the brain become occluded. And on MRI, you see there's little white spots all in the subcortical white matter. Clinically, it looks like Parkinsonism of the lower body.
Okay, one quick last question. Botox for urinary problems.
There are some people that occasionally will do it, but I think I've never had a person have that done.
What about the use of the
Well, you have too many. You're hogging all the questions. Go ahead.
I'd like to know how come some people have moist column and some people don't.
Have more what?
The moisture, column, area. Some have a lot of water. Some people say drink a lot of water to
Oh, you mean for bowel movements?
For bowel movements.
Yeah.
Colon has different amount of moisture.
Yeah.
So what decides, where to send this moisture from the central brain
Yeah, it's automatically, and also what you're putting into your body. And what you put into your body is not just your brain, it's what you decide to put in there. There's a volitional component. You could drink plenty of water with fiber in it and Miralax, and you'll keep your bowels moving because you've changed the composition of what you put into your gut. Your gut just doesn't move very much when you have Parkinson's disease. It just doesn't. And so what's interesting is that one of the drugs that's used to improve cognition will stimulate the gut a bit, and some people can get diarrhea as a side effect, which is okay, it counters the constipation.
What's that drug?
Well, think of Aricept.
Oh, okay.
Aricept is a cholinesterase inhibitor. It stimulates acetylcholine, which stimulates gut
We
movement.
take that?
Yeah.
Okay.
But generally, the constipation far outweighs any stimulant effect of
Okay.
Aricept. Unless you took big doses by mistake of Aricept, and you know because all of a sudden you have a ton of secretion, a ton of diarrhea, stuff like that.